my 60th birthday party next week, and I've got a huge family. My granddaughter Amelia is 7 weeks old. Dad is 82. Do I go ahead with the party or just cancel everything?
I'll put that to Sarah Jarvis.
Well, if this was in 4 weeks' time, I'd probably be giving you a different answer than I'm giving you today. Statistically, at the moment, the likelihood of anybody becoming infected at a party is small. If you have got a very elderly, very frail member of the family, what you might want to do is to ensure that the children don't spend too much time going and sitting on their lap and licking them, which is what children are wont to do. And I certainly would ensure that you have plentiful supplies of antibacterial, 60% at least alcohol sanitizer, hand sanitizer, when people come in. Make sure that people go and wash their hands regularly, and please put paper towels in your bathroom rather than having a towel which everybody shares. But other than that, I would be going ahead with it.
Good luck, Beverly. When is it again?
20th of March.
Happy birthday.
Oh, so it's very soon.
Thank you very much.
Yeah, happy birthday. All right, there we go. Storm.
We're going to speak to Leslie now from Liverpool.
Go on, Leslie. What's your question? I'll put this to Chris Smith.
Oh, hi, Jeremy. Hi. I had the pneumonia injection 2 years ago. I wonder if that affords me any protection against the coronavirus.
Chris.
Hello, Leslie. The answer is it will prevent you getting pneumonia, but it won't prevent you getting this coronavirus. This is a completely new virus. It's never circulated in the human race before. And as such, only people who've already been infected with it and got rid of it are now immune to it. Everyone else is potentially vulnerable, could be infected, and therefore could get the viral infection. But, and there is a but here, your pneumonia jab might give you some benefit, because what we know about chest infections caused by viruses, and flu does this as well, is that it can damage the lung surfaces when you get the viral infection, and this can leave you open to infection afterwards with a bacterium. And some bacteria include those which are represented in your pneumonia jab. And so you can get a follow-on bacterial infection, which sometimes needs antibiotics after a viral infection. So you might be at lower risk because of that, but it certainly won't protect you from getting the infection if you're going to get it.
All right, Leslie, is that helpful?
All right. Oh, yes, thank you.
All right, take care. Thank you. All right, questions from our panel. I'll start with you, Sam, because as we've discussed, you are the most vulnerable to it here.
Such a drama queen, aren't I? So advice for someone like myself. I had pneumonia. I've got the scarring on my lungs. I've got 50% lung capacity. I've got people coming into my home that I really rely on. Am I overreacting by saying, right, as of Monday morning, I do need to self-isolate? You know, am I justified in saying that?
Yeah, I think you are justified in saying that, because what we know about this disease, and actually any viral infection like the flu, for example, common things, is that they can cause serious and more serious infections in people who have underlying health problems or structural lung problems. In other words, their lungs already have some kind of thing wrong with them. So what do you do about that? Well, most people in that position actually already have some degree of plan in place because of previous winters, and they know what makes them ill, they know what keeps them well. Some additional use of things like that, plus saying, if you're going to come and visit me and you've got coughs and colds, please don't come this week. Or don't bring the kids over if you were going to come this week. Maybe we'll leave it for a while. So I'm just urging people to take common sense approach to this, really.
OK. Storm, question for Sarah from the audience.
Yes, so this question we read out earlier in the show. So at the start of the show, we mentioned that Tanya said, Tanya asks, should all care homes close their doors to visitors? They're elderly, frail people. Lots are doing this, but some seem more relaxed than others.
And it's called cocooning, this, isn't it? You just basically close off the care home.
I think it's a really interesting one because, of course, this is exactly what we've seen in Seattle. We've had this enormous problem in the USA. And there is absolutely no question that older people are more vulnerable, but, of course, also people with long-term conditions. So Chris has already mentioned people with lung problems, but also people with high blood pressure, one of the most common factors which seems to have been implicated, diabetes, heart disease, but also kidney disease, liver disease, anybody who's taking medication which could suppress your immune system. And that might be rheumatoid arthritis, it might be inflammatory bowel disease, that sort of thing, chemotherapy for cancer. What we've got, of course, in care homes is we tend to have people who not only are older, which is a risk factor in itself, but they've also got long-term health conditions, which is why they need to be in a care home. And therefore, from my perspective, I have to say, I applaud care homes which are taking sensible precautions. And I think one of the most sensible things to do, because you're going to need carers to go in, they have to go in. I think one of the most sensible things they can do is to stop general visitors.
OK, Storm.
We're going to go back to the phone lines and speak to Bill from the Wirral next.
Go on, Bill. What's your question for Chris and Sarah?
Right, good morning to everybody.
Fire away.
This is specifically for your virologist. Okay?
He's ready.
Right. I believe this disease originally started in Wuhan in China, being transmitted from bats in a food market. The question I have is, if it can be transmitted from animals to humans, can humans transmit it to mammals, i.e. your pets? Therefore, they can increase the spread of it.
All right,
Thank
Bill,
you.
good question. Good question.
Hello, Bill. The answer to this is you're quite right. This virus did originate in animals. It's originally a bat virus, but not completely. It's also got a bit of another animal called a pangolin in it. And we know that by reading the genetic code of the virus. And we think that this mixing and matching either happened in the market or in the wild in an animal that was then brought to the market. And then that jumped into people in the market, and people have been transmitting it person to person. So by definition, this is already an animal infection, which has jumped from at least one species of animal to another species of animal, us. So then the question is, well, will it go in other directions? Well, presumably it could also go back to a bat, because bats gave it to us in the first place, so they're susceptible. So we could infect bats, but that probably wouldn't bother the bat because they gave it to us in the first place. But then the second point is, could your pets catch it? Now, we know that some viruses can cross the species barrier again. During the swine flu pandemic, we actually had situations where there were cases of dogs and cats catching it from their owners, and in some cases dying. There's been a limited number of reports of people showing that this virus can get into people's pets, but whether it actually makes them ill and whether they become really infected and infectious, or whether they just carry it transiently and are not that significantly affected, we don't know at the moment. And this is actually an active area of research, because this is really important, because obviously the more possible reservoirs there are for an infection like this, the harder the problem's going to be to solve. So it's a really important question.
Thanks, Bill. We're still working that one out. Thank you. I heard about a dog in Korea, as people talked about, had been tested positive for it. Oh gosh, Henrietta, you're...
The young man of 25 who caught the virus before it was known to be corona, wrote a very frightening diary of his appalling experiences with the virus.
This is Dr. Lee, the ophthalmologist.
No, a young man of 25 from the north, and he was really brave, and he stood up to incredible pain on his own.
Yes.
He went to the hospital, they said, "You've got pneumonia," gave him antibiotics. He gave himself Vic, and he wrote about the pain. It was actually in the mail. His kitten died.
His kitten died?
Yes, he had a little kitten.
In Britain?
There's a picture of him, of the kitten, and it died.
What's it? Sorry.
I do think that there was a case in, there were a couple of cases of dogs which have tested mildly positive, but I think we mustn't get ourselves in too much concern. There are elderly people whom we're already asking to self-isolate. If we ask them to get rid of their animals as well, I think the likelihood of this becoming very infectious and easily transmitted to another species in such a short space of time, I suspect, is going to be fairly low. But obviously what you don't want is you don't want your dog licking your face anyway, because they can transmit other things.
Yes, good point. Thank you. Storm.
We're going to speak to Jackie now from Gloucestershire.
Jackie, your question for Chris and Sarah.
Yeah, hi. Yeah, I've noticed that the coronavirus doesn't seem to be spreading to countries like Mauritius or India or Africa. I certainly haven't seen it on the news.
OK, so hot countries less susceptible? What do we think?
Hi, Jackie. The answer is that actually that's probably an artefact. In other words, a statistical flaw in the way we're testing. Singapore is pretty warm, and we already know that we've had lots of cases there. So I don't think we can rule out hot countries. It's certainly true that viruses do spread less well when it's warm, and the reason for that's twofold. One is that people spend more time outside when the weather's better. They also spend more time with the windows open at home. So if you've got smaller gatherings and you're ventilating the room better, you're less likely to run into infectious doses of the virus. And when it's sunny, there's higher amounts of ultraviolet light in the air and in the environment, which actually damages and destroys the virus. So we think there's a small impact of warmer countries possibly mitigating the spread, but not very much.
Thank you. Thanks, Jackie. Storm.
We've got Jane out from London who's got a question.
Go on, Jay. And to Sarah, this one.
Good morning, everyone. So my question is how the virus might affect young children, specifically babies. I know we've heard that it doesn't seem to have a massive impact on young children, but babies, say, for example, my son is 10 weeks old, how might it affect him, and what can I be doing to keep him safe?
Jay's 10-week-old baby.
Well, thus far, among very small children, there appears to be relatively very little harm, and there have been very few cases of severe infection. Now, of course, breastfeeding, from your perspective, is going to be giving your baby the very best chance in life. And if you can breastfeed, please keep doing it. Overall, your levels of hygiene when you have a small baby are going to be extremely high, and I would strongly suggest you keep up those levels of hygiene. Just don't, perhaps, you might not want to pass him round. He's not at the stage where he's crawling, so actually I would suggest that in terms of the likelihood of picking it up, it's actually significantly older children, babies who are crawling around and who don't understand about hygiene, who are at higher risk. I really wouldn't worry too much about your 10-week-old baby, because the evidence thus far is that if they have it at all, they are either completely free of symptoms or the symptoms are very mild.
Thank you. That's one of the great mercies here, Jay, isn't it? That it's pregnant women and young babies seem to be much less affected. So I hope that eases your worries.
It does. Thank you.
Thank you for your call. Storm.
We're going to speak to Leanne now from Birmingham.
So what's your question for... Let's put this to Sarah, Leanne.
Hi. Basically, my child has a rare syndrome called cardiofaciocutaneous syndrome. He's in a normal school, and schools aren't closing at the moment. I also work in operating theatres, and there's been a confirmed case within our hospital. So my question is he at a higher risk because of his syndrome and underlying condition?
Well, because his syndrome is so rare, as to my understanding, I don't know every one of the 112,000 cases we've had so far, but the likelihood of any significant number of children with that syndrome having had it is extremely small. However, we can reasonably expect, especially if he's taking any regular medication, which might suppress his immune system, and perhaps if his condition does have an impact on his immune system, that he would be at higher risk. And therefore, if that is the case, then I would certainly consider it before I would consider taking other children. Chris, you...
If I may ask, Leanne, how does he normally get on in your average winter? Does he normally suffer badly with colds and flus and that kind of thing, or does he normally do okay?
He's normally okay. He's got underlying conditions. He has to have his heart regularly checked because that's part of the syndrome. He's got learning difficulties. He walks slower. He gets out of breath quicker. Things like that.
It does sound to me, if you've got a condition that means you're already a bit more vulnerable, that probably you do have a slightly higher risk were he to catch it. But you should reassure yourself that the illness is very mild in children in all age groups, up to the age of 20 or so. So therefore, the risk is already very small. So even if he does have a slightly higher risk, his risk is still very low. So probably you can take some comfort from that. But it probably wouldn't do any harm at all if you decide personally you're going to keep him away from everyone else.
Very quick last question from Bobby here.
OK, I just want to know about the latest figures on airborne infection, just because I've not shook anyone's hands, I've not cuddled anyone for 2 weeks, but I have been on the tube every day, and I've been at work every day, not touching anybody, but in close kind of proximity. And the other night, someone on the tube did cough twice.
OK,
about a metre.
Only got a second.
So the definition of close contact is within 2 metres of anybody for more than 15 minutes. I'm afraid on the tube that is going to be close contact.